Hi everyone, this is Dr. Kala and welcome back to another video. So in today's video, I'm going to be talking about abnormal uterine bleeding as it occurs in the later stages of life, and specifically from age 35 until menopause, and then after menopause, which is what we call postmenopausal bleeding. So starting first with the earlier stage, when abnormal bleeding happens between age 35 and menopause, again, that bleeding can take so many different forms, such as prolonged, such as irregular, such as 2 periods in 1 month, anything that kind of triggers an alarm in your mind to tell you I'm having an irregular bleeding or I'm having an abnormal bleeding that is I'm not comfortable with, then again, a workup becomes necessary. And just like earlier, we said you would definitely start off with a pelvic ultrasound, and that helps evaluate the uterine structure. That helps rule out a fibroid, a polyp, or any structural abnormalities that can cause the bleeding. After the ultrasound is done, it becomes important to take a sample from the inside lining of the uterus. This is what we call an endometrial biopsy. And the reason this is important because after age 35 years old, the risk of developing what's called the endometrial hyperplasia, which is increased thickening and increased glandular production within the lining of the uterus, becomes much more likely. And that's why it's important to rule that condition out. This is a precancerous condition, and that's why it needs to be ruled out. So an endometrial biopsy, where your gynecologist will go inside the uterus, take a sample, and check the pathology, needs to be performed. Once the biopsy is negative, then you and your doctor can talk about what options of management are available. Again, you don't have to sit there and deal with the bleeding. You don't have to settle down for abnormal bleeding because this is your age, and this is what's expected to happen. There's always something to be done. So if your bleeding is a problem, undergo a workup, and after the workup, have a discussion with your provider as far as what to do next. The other part, or the next stage in life, which is postmenopause, and that starts from the age that you become postmenopausal. When you don't have a menstrual cycle for at least 12 months, that declares that you are in menopause. And therefore, any bleeding that occurs from menopause until later in life, 60s, 70s, 80s, is considered abnormal and should be investigated. Again, the investigation involves getting an ultrasound and undergoing a sampling from the endometrial lining of the uterus. This is very important and not to ignore, because the risk of endometrial cancer does increase with increasing age. So you never want to underestimate any bleeding that happens in menopause. If you happen to see a small drop, if you wipe and you see some pinkish discharge, which is something that you've never had before, this is important to notify your physician and undergo an investigation. Don't get me wrong, the endometrial cancer is not the most common reason to have bleeding from the uterus in menopause, but it's definitely one of the most important things and should be ruled out. Once you've had your workup, once you've had your ultrasound and possibly the endometrial biopsy, and everything comes back negative, then you can sit back and relax and observe the bleeding and what happens next. But until you have had your workup done, you cannot ignore any bleeding that happens in menopause. The most likely reason why women bleed in menopause is something called atrophic vaginitis. That's just simply atrophy. Dryness from the tissues within the uterus, dryness from the vaginal area. that, you know, when you're moving around, it causes friction, and the friction causes some irritation, and the bleeding happens or the spotting happens. Okay, but you know, but it's still important to rule out the possibility that it's not something more ominous, like either pre-cancer or cancer. So I hope this give you guys some guiding information. And if you have any questions, you can always consult with your provider and try to get some more information. And stay tuned for another video.